In a deeply disturbing incident of assault on two doctors in KDMC run Shastrinagar Hospital, to understand the entire matter and what is the current status, we are joined by Dr. Sadiya Pinjari, who is the Chief Medical Officer of the Shastrinagar KDMC Hospital. Ma'am, firstly, thank you for speaking to us. As a doctor and also as the Chief Medical Officer, firstly, what do you make of this entire incident? Are you happy with where the police progress has reached?
Yes, let's see, hope for the best.
Ma'am, were you present on duty that day at the time of the incident?
No, I was not there in the late evening. I was given a call by my in-charge sister, Ramesh Mhatre sir has come and there's some heated issue, so please do come. So I came after that.
Ma'am, also the pregnant lady who happily and successfully also delivered a baby, her mother had been claiming that repeated requests were denied to give her a bed. What is the actual reality?
The issue was when the patient had come to show the scan, which was showing that the baby's blood supply is hampering to the brain with 2 loops of cord on sonography. So looking at that, my gynecologist had told the baby may require NICU, so we'll just confirm the bed, and if a bed is available, we'll get the baby out by cesarean. So when we confirmed the bed, there was one bed vacant, but in the meantime, simultaneously there was one patient in labor who was delivered, and that baby was the baby had part stool, so that baby was in distress. So that bed was occupied by that baby. So again, these people had informed them that jo vacant bed tha, that has been already occupied. So now if at all there is, we'll have to look for outside, this NICU which is there, that is also run by third party. So they have their one more NICU in Govandi. So we were trying for that, and since if it is not available, then the patient has to be referred to Sion. This was the communication which was done. But then they started arguing, nahi yahan pe karna hai aise. And after that, sometime they had given a call and Ramesh Mhatre sir had come. This is what I have been informed.
Ma'am, as a doctor, how distressed or rather angry are you by this entire incident? Because it is a very thankless job, a very demanding job, and despite doctors trying to do their best, they have to meet with such kind of treatment.
Absolutely, this is not accepted, because we are serving the country in a way like emergencies. We are standing for that and handling all those emergencies. So I really don't, this is not acceptable.
Ma'am, medical field is one such where VVIP arrogance cannot work, but this culture we get to see a lot. One such incident happened here as well, where both your on-duty doctors were assaulted and people refused to listen to them as well.
Yes, at that moment, see, I am with the patient also. I totally agree that patient, when they are told that यहाँ कुछ नहीं हो सकता, तो वो agitation was natural, but they have to understand, with whatever resources we have been given in the hospital, we are working with the best of the facilities we can give. So that's the request, they should understand that part of the doctor.
Ma'am, speaking of both your doctors, when did they join and how would you generally describe their performance? How would their behavior and attitude also be while dealing with patients?
See, the RMO, Dr. Vaibhav, he had joined somewhere maybe 6-7 months. I am not able to recall the dates. And he was good in his work, responsible as well. And regarding Dr. Shruti, she's just appointed 1.5 months back. So even she was good at her work, no doubt.
Sir, sorry ma'am, both of them, we are learning, have resigned. Have you been in touch with them or their family members? What is their current status? Have you spoken to anyone's mother or father yet?
Both of them, the part of what you are telling is resignation, so we haven't yet received any confirmation, and whatever the confirmation has to come from the agency from where they are coming. And second thing, we haven't contacted them from our side because as a part of agency, they inform us. That's it.
Ma'am, speaking of the police action, are you happy that Ramesh Mhatre and a few of his supporters who were creating ruckus that time and engaged in violence have been arrested and the rightful procedure is going on?
See, it's not the question of whether happy or not, but see, I am here to protect my staff, and that's the appeal from my side and my whole hospital staff. Ke it's a request to all ke they should understand ke whatever is there in my hospital, my doctors and my staff are trying to give the best of that.
Ma'am, lastly, Dr. Vaibhav Salunke, who came under severe attack, has expressed fear. He has even left the city. So, what do you make of incidents like these where a doctor is forced to leave a city and stop doing his job?
It's very bad. That's it. I can't comment on that.
So, ma'am, lastly, this hospital was already facing a doctor shortage, and now with 2 more additional doctors gone, how are you coping up and how are you really managing this pressure?
With whatever staff, as earlier told, we are still trying to adjust the duties. People are doing, means we have changed the duties because we have to give service. That's what.
Also, have you made a request for additional security deployment to your seniors?
Yes, we have got from our commissioner, sir, as he had already assured us, and we have got since yesterday proper police and extra whatever we had, we have been given additional to that. I'm thankful to my commissioner, sir, and my seniors.
Thank you so much, ma'am, for your time. With cameraman Khade, Dev Kotak, Times Now, Mumbai.